Welcome to Your Health. I'm your host, Rhonda Alfred. Joining us on this episode is Dr. Logan St and nurse practitioner Stephanie Durocher from Terrebonne General Palliative and Supportive Care. Today we will discuss palliative and supportive care services offered at Terrebonne General. Welcome to the show, ladies.
Thanks, Rhonda.
All right, well, let's get started with you telling us a little bit more about yourself and your role at Terrebonne General. Dr. St.
Yeah, so my name is Logan St. I am by training an internal medicine doctor, but then I spent an extra year specializing in palliative and supportive care.
Okay, and we'll talk a little bit more about exactly what that means,
Perfect.
right? And Stephanie?
Hi, I'm Stephanie Durocher, and my background was in critical care nursing, and I went to undergrad at Nichols and ended up going to Alabama for grad school. And there I became a family nurse practitioner and acute care nurse practitioner. And then I came here and did hospital medicine, and then 6 years of hospice. And now I'm back here, and it feels like home.
Oh, we're so glad to have you back. Such an important topic that we're going to talk about. Let's start with you, Dr. St. Cyr. What is palliative and supportive care medicine?
Yeah, so essentially anytime somebody gets a really serious diagnosis, it changes so many aspects of their life. They're faced with a lot of new symptoms. They want to gain an understanding of this new disease, and then often just their daily life at home looks different. So our job in palliative and supportive care is to try to really maximize the resources they have to handle the stress and the symptoms that come along with serious illness. So we do a lot of symptom management, but we also talk to patients and their caregivers and figure out what they need at home for their life to look as normal as possible for as long as possible.
Okay, give them quality of life for as long as they can. Great. And what type of illnesses and disorders do you treat, Stephanie?
Yes, well, a lot of our patients have a cancer diagnosis. I would say 3 out of 4 have a cancer diagnosis, but that's not all we see. We also have patients who have heart disease or lung disease. They might have COPD or heart failure. We have some patients who are in stage renal disease, or even some patients with neurological diseases, like even a dementia.
As a palliative care medicine specialist, Dr. St. Cyr, how do you help family members and patients to have better quality of life?
Part of the goal of our service was to really build a service that offers support kind of wherever they are in the course of their illness. And that includes both whenever they're having good days and they see us outpatient in the clinic, and whenever they're having hard days, a service that can meet them in the hospital, and it's, they're seeing familiar faces and people that have known them for a long time. So a lot of what we do on the hospital side, for instance, is if some new issue has come up, we want to make sure that they have all of their questions answered, that they understand what's going on, and that if healthcare decisions come up, that they feel really informed and equipped and supported whenever they're making those decisions, and confident that they're making decisions that are the best decisions for them personally. Also, things like symptom management. Whenever we make those changes in the hospital, they get discharged and they see what their life looks like at home, and their shortness of breath or their pain might be different depending on what their life looks like at home. And then we can follow them up in clinic and make changes there too, to try to just kind of smooth out those transitions.
Stephanie, who are members of your team?
Well, we've got a growing team. It's been amazing. We have, of course, me and Dr. St. Cyr, and Dr. St. Cyr covers the hospital, and she does a little bit of outpatient, but mostly I do the outpatient visits. We have a clinic in the atrium, and then also on the hospital side, we have a registered nurse and an LPN, Melissa and Chantel, and they have just been an amazing resource. They go out and educate the patients on their disease processes and help with their goals and treatment decisions, as well as connecting them to resources in the community. And then we have a wonderful chaplain who's there for spiritual support. And am I leaving anybody out?
That's our team. We work a lot with case management, but that's our team.
Yeah.
So what are the services that you provide, you and your team provide?
Right. I feel like we've touched on a few things because we talked about symptom control, but a lot of the symptoms we deal with a lot are pain, shortness of breath, nausea. And often people have issues with sleep and appetite anytime they have a serious illness going on. And then I talked about kind of decision support, making sure that they really feel like they have a mastery of their illness, and that, I think sometimes it's really scary to get a new diagnosis, and sometimes you feel like the only place you can reach out to with questions is Google. And we want them to know that they're supported by a person who can answer questions in a way that applies to their specific case, not just like general answers that they would see on the internet and not know how that would apply to them.
Right.
And then something else we do that I don't think we've touched on is like advanced care planning. So that concept is kind of ahead of time. whenever you're having a good day and nothing's going wrong, thinking about hypothetically, if I ended up really sick, like what would I want my care to look like? And the reason it's worth thinking about those things ahead of time is because you never expect a sudden hospitalization. And for any of us who either ourselves or a family member have been in that circumstance, it's scary. And you don't want to be having to think about hard things for the first time whenever you're stressed and poorly slept and really emotional. And often whenever somebody's really sick, they can't speak for themselves. And so someone that they love dearly is thinking, what would they say if they could talk?
And I know there's a myth surrounding palliative care that it's an end-of-life care. Is that true or not?
You know, honestly, it's sometimes both. While we are skilled at dealing with a lot of end-of-life issues and perhaps directing them to more hospice, just comfort care, we also, though, we come in with patients that are working on getting better. And sometimes they're dealing with a serious illness, but they do get better. Their cancer treatment works.
So this sounds like a very beneficial service to patients. How can someone schedule an appointment with you?
We take patients by referral, and that referral can come from either their primary care doc or from any of their subspecialists. So they can either fax them over or send them electronically, whatever's easiest.
Okay, so easy to do. Well, thank you so much for all that you're doing for our patients and the community. Thank you.
Thanks,
Ron.
Thanks for having us.
For more information about palliative and supportive care services at Terrebonne General, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alford, and we'll see you right back here next week.